This is Clinical Conversations. I'm Joe Elia. We're going to talk today with the co-chair of the American Heart Association Committee that's just released a statement calling into doubt the long-held belief that there is an association between periodontal disease and atherosclerosis. Our guest is Dr. Peter B. Lockhart, chair of the Department of Oral Medicine at the Carolinas Medical Center in Charlotte, North Carolina. Welcome, Dr. Lockhart.
Thank you.
The idea that there's an association between gum disease and heart disease has been around for a long time, as you say in your statement. Would you please give us just a thumbnail history of that idea?
Sure. The American Heart Association Writing Committee was aware of the controversy and the mixed science on this particular subject, and decided about 4 years ago that it would be good for one of their writing committees to do a complete analysis of the science that's been published in the last 20 years and try to come up with a consensus on basically three questions. The first had to do with whether there's an association between periodontal disease or gum disease and heart attack and stroke, or more generally, atherosclerosis. Then we looked at this issue of, is there causality? In other words, does periodontal disease cause atherosclerosis? And the third question revolved around the issue of, if you treat periodontal disease or gum disease, does that have a positive impact on patients who might be at risk for cardiovascular disease? And the results were very interesting. We found that with regards to association, that indeed there are associations between periodontal disease and cardiovascular disease. Some of them have to do with the fact that there are common risk factors of smoking and diabetes and obesity and age, and the fact that they're associated in some cases has to do with the fact that these occur in these age groups, and they're risk factors for both diseases, but it doesn't imply cause and effect. On the other hand, some of the more recent work suggests that there is an independent association between periodontal disease and cardiovascular disease, and the details of that really need more emphasis in terms of research in the future. With regard to the second point of causality, we did find that there isn't science today at this point to suggest that there is causality between periodontal disease and atherosclerosis. And with regard to the studies where there was an attempt to try to treat patients with periodontal disease, there was no, at least long-term benefit in terms of deaths from heart attack or stroke.
The mouth is a major portal for bacteria, and so it's not surprising that people would have thought that this link existed or had been suspected. But what are the factors that weigh in favor of mere association rather than causation?
Well, there have been several mechanisms proposed. The first has to do with inflammatory products. There's no question that periodontal disease causes an inflammatory response in the mouth, and that really is the result of, or has a result of people losing their teeth eventually. And there is evidence to suggest that periodontal disease causes a systemic inflammatory response, but it's not clear if that has an impact on sclerosis. Clearly, these are surrogate measures for outcomes that really haven't been looked at. And other mechanisms have been proposed. As you suggest, periodontal disease results in fairly frequent, we assume, bacteremias. It's clear from some of the work that's been done in our department that people with increasing levels of oral plaque in their mouths or poor hygiene and increasing disease have more frequent bacteremias from routine daily activities such as brushing teeth and perhaps even chewing food. So there's no doubt that a lot of these oral bacterial pathogens are getting into the bloodstream not infrequently. The question is, does that have any impact on cardiovascular disease? And we weren't able to establish that it did. Some of these pathogens have been reported in some studies to be found in vessel walls, but whether they're part of the pathologic process of atherosclerosis, plaque formation, or whether they're just there along for the ride really isn't clear because there are conflicting studies.
Now, I know that because there's no proof of causation between between periodontal disease and atherosclerosis. You're not going to tell people not to brush and floss. But there are practitioners out there now who are offering treatments on the premise that those treatments are going to lessen the patient's risk for heart disease. What were your general findings about those treatments?
Well, as we point out, there haven't been studies that would suggest or at least demonstrate that the eradication of periodontal disease necessarily will have a positive impact on cardiovascular disease. But indeed, maintaining good oral hygiene and avoiding periodontal disease is important just for its own sake, not just from the standpoint of maintaining teeth on into old age, but it can't be a healthy situation to have bacteremias on a relatively frequent basis.
You end your statement with the following statements that imply a causative association between periodontal disease and specific atherosclerotic vascular disease events, or claim that therapeutic interventions may be useful on the basis of that assumption are unwarranted. So people are seeing ads for treatments, and those ads, at least according to the evidence that you've examined, would be overstating a case. Would you agree?
Yes, yeah, that's true. I mean, we used the term stakeholders. That isn't something that we really looked at, but it's clear to everybody that there have been claims made that are inappropriate based on the science today.
Okay, and one final thing, clinicians, and I'm not a clinician, so I could be wrong about this, but clinicians are not often thinking of examining the mouth during physical examination. They probably, I'm assuming, think that's best left to the dentist. But how might a clinician, how might you remind clinicians of the importance of good oral examinations as part of a physical?
I think you're absolutely right. I mean, physicians during the time that they have for initial and recall visits have quite a bit of territory to cover, and so they can't be expected to do an examination of the oral cavity, certainly not in any detail. And it's an interesting question as to how they might be able to identify patients who have periodontal disease, and for that sake alone, let patients know. And I think there are ways. Sometimes it's quite silent. Patients just aren't aware of the fact that it's going on, I guess somewhat akin to atherosclerosis itself until you get towards an advanced stage. But patients, for example, who will tell you that they've had bleeding with brushing their teeth is a red flag for the fact that they may very well have periodontal disease. And I think that if I had to ask one screening question, that might be it.
Okay. All right. Well, fair enough, Dr. Lockhart. I want to thank you very much for spending time with me today.
My pleasure.
That was our 152nd edition, and all the earlier ones can be found at podcasts.jwatch.org. We come to you from Journal Watch, whose website is jwatch.org. Clinical Conversations executive producer is Adore Yano. I'm Joe Elia. Dr. Danielle Schurer and I thank you for listening.